Good afternoon and welcome to another webinar. My name is Dr. Ken Stewart and I'll be your presenter for today. Today's topic is entitled, I Can't Breathe. I Can't Breathe. For the next couple of minutes, we'll be talking about COPD, but then asking or answering a couple questions. And they are, what is COPD? What are the symptoms? What is the cause of COPD? And what are the potential treatments? What is COPD? COPD stands for chronic obstructive pulmonary disease. This disease is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, mucus or sputum production, and wheezing. Normally, the airways and air sacs in your lungs are elastic or stretchy. When you breathe in, the airways bring air to the air sacs. The air sacs fill up with air like a small balloon. When you breathe out, the air sacs deflate and the air goes out. If you have COPD, less air flows in and out of your airways because one or more problems are occurring. The air sacs and the airways in your lungs become elastic. The walls between many of the air sacs are destroyed. The walls of the airways become thick and inflamed. And the airways make more mucus than usual and can become clogged. What are the types of COPD? COPD includes two main types, emphysema and chronic bronchitis. Emphysema affects the air sacs in your lungs as well as the walls between them. They become damaged and are less elastic. Chronic bronchitis is defined as when the lining of your airways is constantly irritated and inflamed. This causes the lining to swell and make mucus. So the question you may be asking is, what causes COPD? The cause of COPD is usually long-term exposure to irritants that damage your lungs and airways. In the United States, cigarette smoke is the main cause. Pipe, cigar, and other types of tobacco smoke can also cause COPD, especially if you inhale them. Exposure to other inhaled irritants can contribute to COPD. These include secondhand smoke, air pollution, and chemical fumes or dust from the environment or workplace. Rarely, a genetic condition called alpha 1 antitrypsin deficiency can play a role in causing COPD. So, who's at risk? The risk factors for COPD include smoking, long-term exposure to other lung irritants, age, and genetics. What are the symptoms of COPD? At first, you may have no symptoms or only mild symptoms. As the disease gets worse, your symptoms usually become more severe. They can include frequent coughing or a cough that produces a lot of mucus, wheezing, a whistling or squeaky sound when you breathe, shortness of breath, especially with physical activity, and tightness in your chest. What are the treatments for COPD? There is no cure for COPD. However, treatments can help with symptoms, slowing the progress of the disease, and it can also help improve your ability to stay active. Here are some treatments. Quit smoking. If you're a smoker, this is the most important step you can take to treat COPD. Avoiding secondhand smoke and places where you might breathe in other lung irritants. Ask your healthcare provider for an eating plan that will meet your nutritional needs. Also, ask how much physical activity you can do. Physical activity can strengthen the muscles that help you breathe and improve your overall wellness. Medicines, such as bronchodilators, which relax the muscles around your airways. Also, vaccines for the flu and pneumococcal pneumonia, since people with COPD are at higher risk for serious problems from these diseases. Antibiotics, if you get a bacterial or viral lung infection. And you have oxygen therapy, pulmonary rehabilitation, and the last resort, surgery. Since smoking can cause most cases of COPD, the best way to prevent it is to not smoke. It is also important to try to avoid lung irritants such as secondhand smoke, air pollutants, chemical fumes, and dust. This brings us to the end of this webinar. Thank you for taking the time to look at this webinar. And right now, today's date is March 30th, 2020. And in light of us being quarantined due to this coronavirus, thank you for taking the time to look at this webinar. Stay safe, stay healthy, and stay inside. Take care. Have a good day.